Hi, this is Emily York, and this is my mini analysis table presentation for my research project. My first study is titled, "Is Postpartum Depression a Homogeneous Disorder?" Looking at time of onset, severity, symptoms, and hopelessness in relation to the course of depression. The purpose of this article was looking at women with PPD, or postpartum depression, or regular depression, and seeing if having one is linked to the other. The participants included 104 moms with major postpartum depression or depression, and 104 moms without depression. The screening process that was used was using your traditional EPDS screening questionnaire at 6 weeks postpartum. If depression started after that, they would contact their doctor's office for further screening and possible referral to the psychiatrist. If that referral did have to happen, that's where they would kind of try to differentiate between your traditional depression versus PPD. The OB clinic that would do the screening was performing it at both the 6 week and up to the 6 month mark post baby. Results kind of covered a lot of information. I kind of pulled together the main focus of what was related to this article. But the depressed moms were found to be either younger or had previous postpartum depression or depression, and it usually showed heightened signs at that 1.5 week mark after baby was born. Some weaknesses is that the group of moms that just had postpartum depression without any previous depression was actually smaller than the rest of the group. And then some of the symptoms that they use to determine depression could be linked to having just normal having a newborn baby in the house, such as sleep disturbances, decreased energy or appetite, and other life stressors. Some of the strengths showed that 84% had postpartum depression in the first 6 weeks, but it also showed that there is a second run or chance of developing PPD after baby closer to that 3 month mark. In fact, they were showing 98% showed a level of depression within the first 22 weeks after baby. While this study is helpful, a larger group would be ideal, especially if it was more of a collective of moms instead of just ones that volunteered. I think there's a large portion that is missed because you're expecting people to just volunteer themselves, and they may or may not be those that are of higher risk. And then also other strengths and comments is just showing that screening isn't enough on its own, especially with just the first 6 weeks. My second study looks at the onset of postpartum depression, implications for clinical screening and obstetrical or primary care. And in this one, the purpose was to look at the screening process for postpartum depression and what is commonly accepted. They looked at 315 moms within the first year after baby was born, with no history of medication for depression or other mental illness. Moms had to meet major depression status, but without taking medication. They were put in 3 different groups depending on the onset. So if they had depression during pregnancy, within the first 6 weeks, or late onset. The women that were referred to this study came from the Emory Women's Mental Health Program that conducted the study and helped put together the guidelines. The findings showed that postpartum depression can happen during pregnancy, but can still occur up to that 1 year mark. Screening should be done not only with the OBs, but also during pediatric visits. Some weaknesses to this is not everybody goes to their pediatric visits, and most pediatric doctors don't screen the mom for her wellness since she is not the patient. Some strengths show that there is a link between previous postpartum depression or earlier onset of symptoms that may have been missed, showing that the screening ahead of birth is just as crucial, and being aware of mom's risks if she has something in her medical history that puts her at a higher risk for it. And also gives proof that continued care and screening in the first year of baby's life is important. The study continues to show the importance of how longer postpartum care is needed outside of the traditional 6-week mark. My third study is late postpartum depression and associated factors, community-based cross-sectional study. This study was primarily actually conducted only in a small town in Ethiopia. So it's a very small study in the grand scheme of everything, and it looks at a very unique group of women with different risk factors in more ways than one. So the purpose of this study is to look at the occurrence of late postpartum depression and possible circumstances that may contribute to it. It looked at a study of 479 postpartum moms in Ethiopia. The moms had to live in the area for about 6 months while they were gathering this information, but it was actually done over a very short period of time. However, they do have quite a few expected families in this town. But it also included moms primarily over 18 years of age. They collected the data between 4 medical facilities that service that area, both medical and midwifery. Same thing as before in some of those other studies where they could not be on any medication for mental conditions or depression prior to. And they came to the conclusion that late postpartum depression was common and was subject to the factors that brought it on, such as abuse, the impact that the partners had, the feelings that the partners had towards the baby, whether it was their gender or just the overall pregnancy. Most families were of lower resource status, and the abuse also included those women that fell under a sexual abuse factor, so not being able to meet the needs for their partner. Definitely a different culture. Some of the weaknesses, while it supports the idea that many factors can contribute to late onset of postpartum depression as a whole, this study primarily focused only on the factors in this particular town and culture and doesn't look at a larger pool that may contribute. But contrary to that, we could probably take a look at low resource countries or statuses in different countries are going to probably fall in a similar situation. Abuse is all over the place, and cultures all have their own strains and stressors. Strengths, the study does continue to prove that more studies do need to be done regarding postpartum depression, especially on the late onset. And the reason I chose these 3 is I am finding that it is harder to find studies based on just late onset. And these are just 3 of a handful that I have found that all back each other up, stating that more testing is needed, and more screening processes are needed. So postpartum care in itself looks like it needs to be expanded beyond the first 6 weeks of a baby's life.